Hi, my name is Kiana, and what I'm going to talk about today for my paper is a nurse's role in addressing and managing the opioid epidemic. Um, so, to start off, according to Coffee, the opioid overdose epidemic has become a global public health crisis, with the United States experiencing the heaviest impact, reporting over 106,000 drug overdoses in 2021. Um, and then another quote about the statistics for this, Scagloni points out that deaths involving synthetic opioids other than methadone, which is primarily fentanyl, rose from 2013 to 2022 from one death per 100,000 to 22.7 deaths per 100,000. So as you can see, this has obviously become an even greater issue, especially in the last 10 or so years than it used to be. And the reason that I chose this topic specifically is I work in a clinic, physical medicine and rehab, and a lot of our patients that come in have problems with pain. And when they come to see us, the goal is finding ways to treat their pain that doesn't involve just jumping straight to using opioid medications. So I thought that this was a really interesting topic, seeing as I do see a lot of patients dealing with pain. So the purpose of me writing this paper was to kind of explain more or get a better grasp of what exactly our role is as a nurse when it comes to this, because we have a lot of power and we have a lot of say so when it comes to patients and managing and using opioid medications. So, one thing specifically I wanted to focus on is the reasons why um, nurses are or should be so involved in this. I mean, we're the ones that, even though we don't give the orders for the medications, we are the ones that are giving the medications to the patients. So instead of us just, going along with it and just pushing medications, we should be more proactive in, you know, with the doctor as far as the care plan in figuring out, is there another way that we can go about this that doesn't involve just using opioid medications? Um, and also just kind of trying to figure out, is there other alternative pain medication ways or just pain management ways that we could go about that can still help the patient but not contribute to the opioid crisis that we're in currently. And another thing is also one thing, or just to include with that, didn't exactly focus on it, but it's good to include. Um, Also, how much the stigma of opioid pain medications are. Especially, like I said, I work in a clinic, so some of these patients that do have chronic pain do take opioid medications. So, of course, we're a little more like stricter on managing their pain medications, keeping a close eye on, the refills and how long they've been on it, and, definitely checking in with the pharmacy way more than we would with just a regular medication for a patient, just because of how much of a crisis opioid um, medication prescriptions and opioid abuse is. So, one thing that I really found about my topic, like I said, one of the big things that I wanted to focus on that that I saw in my articles for my topic was kind of other ways that we can kind of get a hold on pain management that doesn't require opioid medications. And some things that I saw were, maybe talking with the patient about what alternatives we could do. One of the big ones that was mentioned in the article was physical therapy and occupational therapy, especially after a surgery. And again, as someone who works in a clinic, a lot of our patients do physical therapy and occupational therapy. And when I talk to these patients, a lot of them do say that having the physical and occupational therapy really does help alleviate their pain. In some cases, it might not take the pain away completely, but it does help. And that's even shown in the articles that I was researching for my paper, that these were ways that could alleviate pain that obviously don't resort to just using pain medication. And some of the other ways were suggestions of, is there exercise that patients can do? Is there like warm or cold compresses that they could use at home to kind of alleviate the pain? That was some of the interventions that were mentioned um, with my paper. And I think that this can be a very good set of interventions, especially not just for me as a nurse, but for nurses in general. If there's other ways that we can be more proactive and more of an advocate for our patient to speak up about, hey, is there another alternative pain management strategy that we can try that can still benefit the patient instead of just throwing pain medication at them? Because not only will it benefit them, but it will also reduce the risk of them possibly turning to opioids in the future. Um, Although there are some barriers to this, obviously, because when you have anything like this, you're going to have some barriers. Um, there's still a stigma around opioid crisis. Sometimes, especially working in a clinic, a lot of times insurance is a barrier too. You might have an alternative pain management strategy that you want to try, but sometimes it's not always covered by the insurance, such as physical or occupational therapy. Um, and then sometimes some patients don't necessarily want to put in the effort to do the exercise or the PT and the OT and all that kind of stuff. They just kind of want, like something that's going to help with the pain immediately. So, when we kind of put into perspective these barriers, we just kind of have to figure out, well, is there a way that we can educate the patient on how these pain management strategies can be more beneficial for them, not just right now, but also in the future? And also making sure that we keep a closer eye on if a patient is taking an opioid pain medication. Are we tracking to see when they do refills? Are they refilling them, trying to refill the medication sooner than they are supposed to be? Making sure we're doing our face-to-face visits to check in like every couple of months, just to make sure that everything's okay. you know um some of the other things we can do is working with our providers and working with some of our staff to kind of figure out, okay, insurance says no to this. Is there something else that we can do that can still help the patient? So, a lot of that kind of stuff is something that we can do as nurses. We can also ask the patient, hey, what would you prefer? Like if you don't want to take opioid pain medications, but we want to help manage your pain, is physical therapy something that you would be able to do? Do you have a way to use a warm or cold compress at home? Would you prefer another over the counter medication that might be able to help alleviate some of that pain? So that's kind of some of the things that we can do, nursing practice wise, to kind of help combat this problem. Um, so yeah, um, this is a very important subject, and I feel like it is important for us as nurses to be able to um, recognize what we can do for our patients to avoid putting them in this sort of situation, but to also help them achieve better health for the future. All right. Well, thank you.